Hey everyone, Dr. Aaron Moreland here from Vallejo Health and Wellness Center in Eden Prairie. Today I'm going to be talking to you about low back pain. It's the #1 reason people will go to a chiropractor. Millions of people suffer from low back pain every day. And I'll tell you, when people come into my office, typically what they're going to show me is they tell me I've got low back pain, doc. They'll point right in here, or they'll point off to the side. This we'd call the SI joint, the sacroiliac joint, or they just point right along this belt line right in here. They may show it on the other side. That's very typical. Not too often will you see people say that they got back pain here or here. We do see it, but it's not as common. And so what I want to talk to you today, though, is about something that very few doctors understand and very few doctors will even treat. And I would say it's one of the #1 reasons why people have low back pain. And I'm telling you, it's actually coming from the front of their spine and not from the back. So I'll work with a lot of patients that have this, and I start working on their stomach, and they start wondering, okay, does this guy really know what he's doing? I told him that my back hurt, not my abdomen. But one of the reasons why I do that, why I go through the stomach, is because that's where a muscle called the psoas muscle attaches. And that psoas muscle goes from the front of the spine to your ilium or your pelvis, and then there is a larger portion of it called the iliopsoas, which there's another muscle that attaches in through there, and they both attach to your femur. But this portion, the psoas portion, can be a major cause of low back pain. And so the reason why is because the psoas is a hip flexor. So what it does is it brings that leg up like this, or it might bring you forward like this. But what's happening in many, many people is that muscle gets really tight. And there's a lot of different reasons for that, but some of the big ones that I see is a person that sits all day long. So if you sit, you can see that muscle, I'm in hip flexion, so that muscle is being shortened. And if I sit like that for hours on end, when I go to stand up, that muscle thinks it's being stretched here, and then it'll cause back pain. It'll send a signal to your spine letting you know that it doesn't want to be stretched like that, so it can cause all kinds of problems. So sitting can be a big one that we'll see. Another one will be sway back posture, and I'll exaggerate it here, but sway back posture looks like this. It's the person that's walking with their hips way forward, and that can come from sitting. It can also come from having issues like a spondylolisthesis, but a lot of times it's from people that are sitting and causing those hip flexors to be shortened. Another can be people sitting or sleeping. One of the things I ask people all the time is when they come in is, well, what position do you sleep in? And a lot of people will say they either sleep on their back, their side, or their stomach, but a lot of people will say when they say they sleep on their side, I have them demonstrate, and what you can see here is that a lot of people will sleep like this. So they're kind of on their side, but they're really side/stomach. And the problem with that is you can see my leg is moved up in that posture, and then what happens is if I'm there, like we sleep for 6 to 8 hours a day, so that posture, we could be in that posture for 4 to 5 hours and not even know that we're in that posture, and that can cause problems with shortening that psoas muscle as well. Another one that we'll see, and I see this a lot in runners, is when you're running, what's supposed to happen is your glutes push you forward. Okay, so you really need strong glutes. You also need glutes because when you are on one foot, because when you're running, you're on one foot all the time. You need to have your glute to hold that pelvis from doing this. Okay, and so one of the things that the hip flexor can help you to do is hold that position, stabilize that pelvis so it doesn't do that. And so what can happen is if the glutes are weak, then that psoas has to be engaged a lot. And the other thing you'll see is that what people will do is when those glutes get weak is they start to pull their leg forward rather than push it forward. Now I know it looks exactly the same when I do it, but you can really feel the difference if you push with that pelvis versus pull with that, or push with that glute, I should say, or pull with your psoas, you can really feel the difference. And so that can also create problems. We also see it with people when they're sitting or when they're standing and they're leaning. Okay, so I might be talking to someone leaning like this. I'll have my weight all on one leg. That's obviously going to create a problem, and I'm going to tilt my pelvis, so create some tightness in that psoas muscle as well. Or if I'm sitting in my desk at work, very few people are sitting in perfect posture. A lot of times as we get sitting for a long period of time, we start to lean. We maybe lean towards that our mouse side. And so what happens is we get a short, tight psoas there as well. Or when we're driving, again, very few people are driving, sitting up nice and tall. We start to lean, start to get to, we got that console there, start putting our elbow on there, get that low rider look going, and what that can do is it can really cause those muscles to get tight on one side. I literally had a patient the other day that came in that had back pain, and I found that she had a tight psoas muscle. She also had a tight quadratus lumborum, or a QL, and I'll get into that in 1 second here. But she had these both tight on one side, and what it was causing the muscles to be tight on the front and the muscles to be tight on the back, and it caused her to have a short leg, because what happens is you get tight muscle here, you get a tight muscle here, it causes that pelvis to raise up, and then what happens is it causes that leg to be short, so now I got a short leg. People, I see it all the time, they come in and say, oh yeah, I was told I got a short leg. Well, the key is it functional, meaning is it because you've got tight muscles, or is it anatomical? Is it really short, meaning that you have one bone that's short than the other? Most times it's what we call functional, that it can be changed. And so that pelvis is short, or that leg is short on one side, the pelvis is low on that side. So they're walking around like this. Well, they really can't walk around like this, so then they tilt their spine, and you could see how that would create abnormal stress at the very base of their spine or on that SI joint, and so it can create all kinds of problems. And so we got talking, and like, well, what are you doing that maybe is causing this? She's like, I have no idea. I sit good. I walk well, I sleep in a nice neutral posture. And so she got off the table, and then right after she got off the table, she's sitting there talking to me, and this is how she was standing, talking to me. And so you can see that this would create all kinds of problems. So when we're standing, we could be leaning, okay? So how do we fix this? Well, ideally, there's a few things that we can do. Probably one of the biggest ones is to look at our posture. When we are sitting, you don't want to be sitting for more than really an hour at a time. I tell people every 45 to 50 minutes, get up and move your body, because when we sit for a long period of time, that's when we start to create these weird postures. The other thing I highly recommend is that people would have a sit-stand workstation, and every hour they would switch from sitting to standing, and really be conscious that you're not leaning one direction when either you're sitting or when you're standing. Other things that we do in the office is a lot of times those muscles, when they've been tight like that, they develop trigger points or knots in a muscle. So I do a lot of trigger point therapy to release those muscles. Adjustments help significantly. So a lot of times this SI joint will lock up on them because it gets so tight around there because of that short leg. This right here, I had mentioned the QL. Well, the QL attaches from here to here too, and so that's on the back side. It gets really tight. A lot of times I got to work on the trigger points there, and then this area right in here of the spine will get locked up because that's where those muscles attach. So getting that adjusted, getting that joint to move better will be significantly helpful. And then I also look at stretching. So some of the ways to stretch that. One easy one that can very simple to do is to just do a lunge. And so getting into a long lunge like this can be helpful. I'll show you on the floor. It will be helpful. And then whatever side's really tight, reaching up like this and leaning away from that tight side, because you'll stretch out that QL. You also will stretch out that hip flexor in that posture. So stretching could be really helpful. Sitting for a long period of time, just reaching up to the sky, trying to put your fingers through the ceiling can be very helpful as well. So you can see there's a lot of things you can do on your own, but a lot of times people need to come into the office to have us do those trigger point therapy on them, and also to have those adjustments done, because that will also help that muscle to finally relax, reset the nerves that are inside that muscle to help that muscle to not be so tight. So hopefully this is super helpful for you, because like I said, a lot of times people have low back pain. They would never think that the problem is in the front of their spine, and many, many times it is. And the issue that happens is if people have that long term, if they have that abnormal pelvis and such, you will start to create abnormal wear and tear. You'll cause degenerative changes in your spine, and you can also lead to herniating discs. So getting this taken care of sooner than later is absolutely critical, and going to the right practitioner to make sure that they are getting that back pain addressed, not just cracking your back to make you feel good for a few days and then have the problem keep coming back. So again, my name is Dr. Aaron Moreland from Vallejo Health and Wellness Center in Eden Prairie, and I hope to see you in the next video. Hopefully you're finding these videos helpful. If you are, please subscribe to our channel, hit the notifications button so you know when we're posting videos. We're posting videos, a couple videos a week, so that we can be helping you to be as healthy as you possibly can. God bless.